I'm Dr. Kiran. I'm a medical gastroenterologist, Narayana Health City, Bangalore. So in this video, I'm going to talk about intragastric balloon placement. So intragastric balloon placement generally we do in obese patients with BMI more than 30 and less than 40. And again, what are the indications of this patient? Patient already on strict diet regimen, exercise, not able to lose weight, unfitting, and BMI between 30 to 40 are the ideal patients for the intragastric balloon placement. And again, the age more than 22 years and less than 50 years are the ideal patients for balloon placement. And again, what are the contraindications of intragastric balloon placement? Again, the contraindications like reflux disease, severe reflux, C and D, any strictures with the esophagus or any anatomical abnormalities or any earlier prior abdominal surgeries or patients on antiplatelets or patients having some malignancy in the stomach, esophagus or in the duodenum and large pyloric channel, and patients have any other neurological disorders or any psychological disorders. All these things are the contraindications for intragastric balloon placement. Generally, prior evaluation of the patient is required, and basic lab parameters like hemoglobin, LFT, coagulation profile, ultrasound, and one endoscopy to assess for presence of hiatus hernia, any reflux disease, or any diverticulum. So all things are required before placement of the intragastric balloon. Once the patient is fit, all lab reports are normal, no major abnormalities in the endoscopy, then we'll go ahead for the placement of the intragastric balloon placement. So this is done under sedation. So again, the PAC, all those things should be done earlier to the procedure. So once everything is cleared, so again on the day of procedure, patient should not eat anything. So patient should be on fasting for at least 8 hours. So under the endoscopic guidance, under endoscopic visualization, we will put the intragastric balloon inside the stomach. So we'll inflate the balloon. Once the transducer and the balloon is inside the stomach, we'll inflate the stomach with normal saline mixed with methylene blue. And again 400 to 700 ml of fluid is required to inject the balloon. So once the balloon is deflated in the stomach, then again we can dislodge the balloon inside the stomach. Again, the balloon has a marker, radio opaque marker. So later you can check through the X-ray if required on follow-up regarding the position of the balloon. Once the balloon is placed, again the patient should follow strict diet regimen. Again, the diet chart we will give after the placement of the balloon. So again, strict diet and exercise, physical activity, all those things patient has to do. And again, patient should not be on any antiplatelets for any cardiac issues or any other thing. Patient should not take antiplatelets, anticoagulation for at least 6 months. And again, how the intragastric balloon works is, so it decreases the gastric emptying and almost it compromises almost like 50 to 60% of the stomach volume. So thereby patient intake will be reduced, and again it helps in weight loss. And again, the rapid weight reduction we see generally during the first 3 months. And the maximum duration a balloon can be kept in the stomach is for 6 months. So after 6 months, we need to remove the balloon through the endoscope. Suppose if the patient missed the follow-up, and if the duration of the balloon is more than 6 years, again chances of deflating the balloon or the volume reduction of the balloon, or even it can cause some obstruction, all those things can happen. So again, patient should be on regular follow-up with the doctor, and even before 6 months or exactly after 6 months, we need to remove the balloon. Thank you.